system examination. It is part of neurological examination, as we are giving commands to different students about the different neurological examination in a certain patient. We divide that neurological system in sensory system examination, motor system examination, then there is cranial nerve examination, cerebellar system is many a time asked in a separate way, and then higher motor functions, higher mental functions are there, and speech examination is many a time asked in isolation, and the same way the signs of meningeal irritation are asked in isolation many a time. And motor system examination is considered as one of the most important part of that examination, which command is usually given to candidates in exams. So talking about the sensory system examination, the most important thing you guys need to understand is in that system, better you educate the patient, your interpretation and your results will be way better. But if you don't educate the patient the right way, you won't be able to examine them the right way and your findings will not be appropriate. So do spend some time in educating the patient the right way. As per all examination principles, remember 4 things at the start of examination and 2 things at the end of examination. These 4 things are: approach from the right side first, second, introduction, telling your name to the patient, asking about his name. Third, proper exposure, adequate and proper exposure. Whatever system you are going to examine, you have to examine it in a way where you should properly expose the patient. And then the 4th thing is consent. So proper consent should be taken. Obviously, for that exposure, you are supposed to take proper consent first. And then at end of examination, saying thanks to the patient and recovering the exposed parts. That's another important point. Before we start examining this sensory system and we start doing all these things, one thing is very important. Whatever command will be given to you in exam, that examine the sensory system of this patient, remember there are 2 ways how you can examine the patient. One is in the dermatomal distribution and one is in the kind of glove and stocking type of distribution, mean distally to proximally. So remember, if examiner has not exclusively asked you to examine the sensory system in dermatomal distribution, you should start examining yourself from distal to proximal. Approach will be start examining distally and keep on moving proximally, and wherever say there is some abnormal sensation distally, and at a certain point when you are examining, you find that sensations are no more abnormal, you just stop then and there. So this is the approach. Distal to proximal is the rule of exam, not in dermatomal distribution. But you should obviously be knowing about this dermatomal distribution, because any examiner may ask you in exam to do that examination that way. Only then you would be doing that way. So to memorize these dermatomes, just remember the C1 has no supply, the C2 supply the nape of the neck, the C3 supply this area of front of neck, the C4 is supraclavicular area, the C5 is up to insertion of deltoid, C6 is hold your thumb and index, C7 hold your middle finger, C8 hold your lateral 2 fingers, it goes up to that point. Then T1 goes up to the mid of forearm, T2 is axilla, T4 is at the level of nipple, T7 is at xiphisternum, T10 is at umbilicus, this is L1, then L2 is front of thigh, L3 is knee, L4 is medial side of lower leg, L5 is lateral side of lower leg along with dorsum of foot, and then S1 is the sole of the foot and goes up to the Achilles tendon insertion, and from Achilles tendon insertion upward up to the buttock region, this is S2, and then S3 and S4 and S5, they form rings around the anal region. So these are the different dermatomes. How do they help you? That if somebody asks you that please examine the C7 dermatome, obviously sensations will always be the same, that you would be checking for sensation of fine touch, proprioception, vibration, that will give you information about the posterior column of the patient. And then if you would be examining the sensation of pain, temperature and crude touch, this will be helping you to localize a lesion in the lateral column of the patient. Sensation will remain the same, but you would just be examining that particular dermatome. Like you would be performing all the things on the same area. I am asking as examiner that please examine C7 dermatome. I'll be checking for touch on that particular area. I'll be checking for sensation of pain on that particular area. So you just keep on checking the most important sensation out of these different sensations which we will be assessing in this patient. Again, before starting, if we are examining the sensory system as a whole, divide the sensory system in three equal halves. The 3 points for the posterior column sensations are sensation of fine touch, proprioception and vibration. And talking about the lateral column sensation, the points are pain, temperature, crude touch and pressure, both can be checked. And then talking about the cortical sensation, remember the 3 things: astereognosis, graphesthesia and 2-point discrimination. While examining, I will keep on telling you how to examine these sensations. So we start with the examination. I am coming from the right side. Assalamu alaikum, मेरा नाम डॉक्टर आदित्य, आपका क्या नाम है? डॉक्टर साहब मुझे आपका मुआयना करना है थोड़ा, तो उसके लिए मुझे आपका जो कपड़ा है तकरीबन गुडनेस थोड़ा ऊपर करना पड़ेगा, मेरे पास इजाज़त है. So what I have asked the patient here, so his name is Tahir. I have asked him that I need to examine your legs, I need to examine your arms, and for that I need adequate exposure. The adequate exposure for sensory system examination is exposure up to the mid of thigh as far as legs are concerned, exposure up to the mid of arm as far as upper limbs are concerned. So I am exposing the patient up to that part here. बस थोड़ा सा इसको भी ऐसे कर लें. And I'll be checking all the sensation on lower limbs. Obviously we have to perform exactly the same way on the upper limbs. So we start with the sensation of fine touch. I am checking posterior column sensations first: fine touch, proprioception and vibration. These are the 3 sensations. For fine touch, what we need? For fine touch, we just need this cotton. We'll be just making this shape of cotton. And now the education part starts. We need to educate the patient right way. Only then we can have good inference of our findings, whatever we are performing on the patient. The interpretation would be right that way. ये आप देखते हैं, ये एक बात है, ये मैं आपके देखिए यहाँ आंखों पे लगा, पता चल रही है आपको? महसूस हो रही है, ये पता चल रही है? महसूस हो रही है. अच्छा, मैं ऐसे ही आपकी टांगों पे लगाऊंगा. जब भी आपको महसूस हो, आपको पता चले कि ये लग रही है, आपने मुझे बताना है, ठीक है? ये शुरू करूंगा मैं ऐसे, नीचे की तरफ से ऊपर की तरफ जाऊंगा. जब आपको महसूस हो कि जैसे यहाँ पे लग रही है, वैसे ही आपको वहाँ पता चल रही है, आपने मुझे बताना है. So what I have told to the patient here, I have asked the patient that I am going to touch your feet, legs with that cotton, and whenever you can appreciate that this is touching your body part, do let me know. And obviously, as I have to examine these sensations in lower limbs, so while educating the patient, I have touched that cotton on his forehead, on his face, and you can ask from patient in exam that sensations of your face are all fine. Like you may find a certain patient who is having abnormal sensations, already abnormal sensations on his face. If a person is having trigeminal nerve lesion, this is a supply of the face. So you can ask this thing from the patient as well, so that his face sensations are normal, and then you can obviously compare those face sensations with his leg sensation. So अपने आप की ऐसे प्लान लगाओ, आंखें बंद करने अपनी. I'll be asking the patient to close his eyes for me, and now what I am going to do now, I have to move from distal to proximal part. So this is the rule, right? So जैसे आपको लगे ना जी कि कोई चीज़ लग रही है, तो आप मुझे फौरन बताना है. लग रही है. अच्छा, ये बताइएगा कि जैसे आपको वहाँ लग रही है, वैसे ही यहाँ चेहरे पे लग रही है, इसमें कोई फर्क है? एक जैसी है. So this is the next thing we are supposed to ask, that when I am touching this his big toe and I am moving from the distal part towards the proximal part, as soon as I touch, he said that yes, I can appreciate. The next thing you are supposed to ask from the patient, I asked him whether at both areas you are having same feeling or it's comparatively less on your feet in comparison with the face or forehead. What it will tell us? Remember, if there is no sensation here, say up to that point, ankle joint, there is no sensation, I would label it as patient is having absent sensation of fine touch up to the ankle. And then as I move ahead, at this point patient say, I can appreciate the sensations, but in comparison with face, I feel less. So there is, in comparison, he cannot appreciate it that well, the way he is appreciating it on his forehead or face. What it will tell us? It will tell us that sensations are impaired. So there are two words. One is, say, absent up to ankle, impaired up to mid of lower leg. And then here my patient say that yes, now I can appreciate that sensation exactly the same way as I am appreciating on my forehead or face. What it will tell us that now these sensations are comparable, and this sensation modality of that fine touch, this is now normal above mid of lower leg. So remember these two things, one is impaired, one is absent altogether, and you need to compare these things. Same way I'll be going to the other limb, I'll again be moving proximally, and an important point is, if at a certain point patient tells you that now I can appreciate that sensation the same way as I am appreciating at forehead or my face, stop then and there. We are not supposed to move proximally. So that's the point. In sensory system examination, at any point, if patient can appreciate any sensation exactly the same way as we are comparing it with face or forehead, we will stop then and there. We are not supposed to move ahead. But if some examiner asks you to examine the sensations in dermatomal distribution, we will never stop, because we have to check the sensation in every dermatome. So that's the differentiating point, right? Another thing is, remember, there is a very, very important rule. When we are checking sensations that way, and a patient is having loss of sensation, we call it glove and stocking type of distribution. Mean the distal sensation, why we are not moving proximally here? Remember, the distal sensations are always lost first. Proximal sensations are lost lately. That's another very important thing to understand in neurological examination. Remember one golden rule. These neuropathies, which may be sensory, which may be motor, which may be autonomic, they always follow the length rule. So remember that length rule. What do we understand by this term length rule? By length rule we mean that more distal the fiber is from its cell body, earlier the sensations will be lost. So that's the rule. More distal the nerve fiber is from its cell body, the earlier its sensation will be lost. So how we can interpret this thing? We can interpret this thing by that way, that if somebody is having like lesion at the level of lumbar region, that thoracolumbar vertebra is there, and inside you know that there is spinal cord. If somebody is having problem at say spinal cord, mid of spinal cord level, T12 level, so what will be happening here? You would be appreciating with the dermatomes, you can understand that this is T10, this is L1. So one thing is, by knowing the dermatomes, you know that where is the problem. As you are moving distal to proximal, what I want to highlight here, by this word, more distal the fiber is from its cell body, earlier its sensation will be lost. If you look at this part, here our spinal cord ends at L2, L3. And just look at the distance of this part from your feet. Here is the big toe, here is that part. Almost, if we see the front side, it will finish here. Now look at this distance, and then look at this distance. From neck up to your hand, the distance is short. So as per rule, the sensations will always be lost in the lower limbs first. As patient will be having loss of sensation in the foot, and as he will be having loss of sensation up to the middle of lower leg, your patient will start saying, now I am having numbness in my hands as well. Because now the distance is equal. From cell body here up to that point, from cell body here up to that point, now this distance is equal. So patient will be saying that I am having loss of sensations here. As a patient will be having proximal loss, this loss is progressing. As this thing will reach up to this elbow, what your patient will be saying? He will be saying, Doctor, I am having loss of sensations at this point. And now I am having loss of sensation up to that point. I am having loss of sensation up to that point. Why this thing is happening? Because the intercostal nerves, which are exiting from that spinal cord, now their distance, this thing is starting from here, ending at this point. This distance is now comparable with this distance, from neck up to that elbow. So as soon as that distance is equal, the chances are that he would be having loss of sensation up to that part as well. So neuropathies always follow the length rule. More distal a fiber is from its cell body, earlier its sensation will be lost. Therefore, we do not move proximally. We find loss of sensation at the proximal distal part, we do not move proximally. That's the point. So next thing is then proprioception. What is proprioception? Proprioception is basically the joint position, where the patient can appreciate his joint is moving upward, downward, in whatever position it's moving. We check it with the proprioception. In proprioception, what I'll be doing first, I'll be first educating the patient. Education is, I'll be telling him that I'm moving your big toe upwards, downwards, this is the mid position. First, I'll be educating him the right way, and only lately I'll be asking, now tell me whether you can appreciate it, that it is moving upward or downward or it's static. ये आप देख रहे हैं अपना पाँव का मूवमेंट, and always this is your responsibility to educate the patient the right way. You should show him clearly what do you mean by this. ये देख रहे हैं आपने पाँव का मूवमेंट, ये आपका देखें ऊपर जा रहा है, ये नीचे जा रहा है, ये कहाँ है दरमियान में, so ये कहाँ है, ये कहाँ है और ये कहाँ है, ठीक हो गया. अब मैंने ऐसे ही आपसे पूछना है, तो आपने मुझे बताना है कि ऊपर है, नीचे है, दरमियान में, आंखें बंद कर लें. So what I have done here, I have educated the patient in detail that I am moving your big toe upwards. Ask him that this is upwards, okay, you understand it. Ask him, now this is downwards, you understand it. Now it is in the mid position, you understand it. When patient has developed good understanding, only then you would be asking him, now close your eyes, and now I'll be moving it upward, downward, or in middle position. You are supposed to tell me where it is. Keep on moving like that. Up किधर है? Keep on moving like that. Up. Up. So I'll be checking on both feet. Obviously, I have to check on both feet. And if this sensation is normal, should I check at ankle joint? The next is then ankle joint. There is no need to check at ankle joint because patient can appreciate the distal most sensation. At ankle, obviously, I'll be moving down, I'll be moving up. Then the next one is knee. I'll be flexing, I'll be extending the knee, and this question I'll be asking from the patient. This is proprioception. The next sensation, fine touch, proprioception, vibration. How to check for vibration? For checking the sensation of vibration, you need obviously tuning fork. This tuning fork should be 120 Hertz preferably. 120 Hertz vibrate in a real good way, and patient can comfortably appreciate it. Right? So what we do here, again we will be comparing it with his forehead. We'll be checking this vibration on joints. I'll be placing first, what I'll be doing, I'll be Just like that, I'll be striking this tuning fork on my hand. It will start vibrating. I'll be placing it on the forehead and I'll be asking patient, can you appreciate this sensation of vibration? When a patient has developed a good understanding that he can appreciate the sensation of vibration, then I'll start examining, right? So ये देखिए ये क्या हो रहा है, ये थोड़ा सा हिलती हुई पता चल रही है आपको, वाइब्रेशन से पता चल रही है, ठीक है? So problem is, if you are having 128, you can comfortably appreciate. This is unluckily 512. This doesn't vibrate to that extent. So ऐसे ही मैंने जैसे आपको ऊपर पता चली है ना वाइब्रेशन, ऐसे मैं नीचे चेक करूंगा आपके पाँव पे, तो जैसे ही आपको लगे कि ऐसी हिलती हुई चीज़ आपको महसूस हो रही है, आपने बताना है. Now remember, there are words. One thing is, I'll be asking the patient कि आपको जैसे वहाँ पता चला ऐसे कोई चीज़ हिलती हुई, वो आपने बोलना है. So I'll be asking the patient whether you can appreciate the sensation of vibration or not, because many a time you ask, so can you appreciate it on your foot, and patient reply goes like, yes, I can appreciate it. Now this would be sensation of touch merely. It won't be a sensation of vibration. So you need to speak those exact words. And in Urdu, many a time you speak so complicated words that patients cannot appreciate. Many a time students speak the word thar thrahat, sansnahat, junjunahat. I mean, these are quite difficult words. Probably you guys won't be able to understand this. So please speak the easy ones. उसे कहें आपको लग रहा है ऐसे कोई चीज़ हिलती हुई पता चल रही हो, बस that's very fine. So you just need to tell them in the easiest possible way. आंखें बंद कर लीजिए अपनी. कुछ पता चल रही है जी हिलती हुई? Fine, ठीक. So why he said no? Obviously, because it hasn't vibrated to that extent. With a good tuning fork, obviously there would be significant vibration, and you can keep on moving like that. First I'll be placing it here, then next I'll be placing it here, and if patient can appreciate the distal most sensation, you are not supposed to move proximally. The rule will remain the same. You are not supposed to move proximally if patient can appreciate the distal sensation. So that was about the first three modalities: fine touch, proprioception, vibration, pain. The sensation of pain, it's quite easy to get it checked. So I have one toothpick with me, which I have lost probably. So do you guys have another toothpick? Otherwise we can use something else. ला दें, अगर गिर गया तो ला दें. Where is the toothpick? You have got one? Fine, thank you very much. Okay, so what we'll be telling the patient? ये देखें, ये आपको चुभ रही है, ये चुभती हुई पता चल रही है. See now, I haven't used the word. क्या ये महसूस हो रही है? क्या ये लग रही है? I have asked about whether you can appreciate it कि ये आपको चुभती हुई पता चल रही है. As a general rule, what we are supposed to do? So we are supposed to have a pin in our hand with one blunt end. The one end should be blunt and the one should be sharp. We will keep on changing this sharp end with blunt end. And we'll be asking the patient whether you can appreciate the sensation of pain, chubti hui. When we'll be placing this blunt side, obviously the patient will just say that there is no sensation of pain, but I can just feel it, I can just appreciate it. So यहाँ पे मैंने इसलिए ये देखिए, ये क्या है जी? ये है नोक, ये क्या है? और ये क्या है? सिरा. ये देख रहे हैं? ये है जी क्या? पता चल रहा है? ये चुभती हुई आपको पता चल रही है. और फिर गौर से जरा देखें, ये देखें आप,
इसके ऊपर रहा हुआ है.
बिल्कुल सही, वो मैं कर देता हूँ जी. ही इज क्वाइट राइट अबाउट इट. अब ठीक है, और ये चुभती हुई पता चल रही. अब मैं ऐसे लगाऊंगा आपके पाँव पे, आपने चिपकाना है. So he himself told me that it's still not, it's bit sharp, and only if it will be blunt, I would be telling you that this is blunt, and then now he can appreciate that one part is blunt, and he can just appreciate it. The other part is sharp, and obviously with that sharp part when you will be touching, patient would be able to appreciate it. So there are two ways. One is you keep on changing this blunt and sharp, and the other is you keep on moving proximally once you ask from patient whether you can appreciate the sensation of pain, and then just keep moving proximally. आंखें बंद कर लें, मैं अब आपसे जैसी चुपती हुई पता चले आपने मुझे बताना है. ठीक है, ऐसी है जैसे ऊपर थी चेहरे पे. So again the same thing will be done. If patient can appreciate both sensations the same way, it means pain sensation is intact. If he would have told me up to ankle joint that I can appreciate, but there is difference, then I would have said that this is impaired, right? So this is how you keep on moving proximally. अच्छा ये जरा बताइएगा मुझे कि जब आपको लगे चुभती हुई तो आपने बताना है, और अगर आपको लगे कि चुभ नहीं रही, सिर्फ ऐसे ही मैं करता जा रहा हूँ, चुभ रही, अब चुभ रही है. So patient can comfortably differentiate these two modalities. So this is how you check these sensations of pain. Then the next is crude touch and temperature. For crude touch, you simply use a crude method that you are just placing. कि मेरी उंगली आपको पता चल रही होगी लगती हुई, ठीक है नहीं? ऐसे मैं आपके पाँव पे दूसरे किस्म में लगाऊंगा, तो जैसे लगाऊंगा आप मुझे बताना है कि वहाँ आपको पता चल रही है. आंखें बंद कर लें अपनी. कहाँ पे लगी? ठीक हो गया. आंखें बंद रखनी है ऐसे. So patient can comfortably appreciate. As you are examining a certain patient and you have educated the patient multiple times, things become quite easy for patient to understand. So in crude touch आप वो कॉटन इस्तेमाल नहीं करते, बल्कि आपका एक क्रूड टच होता है, आप सिंपल फिंगर के साथ पेशेंट से पूछ सकते हैं. The last one is then temperature. In exam, when you are going to assess that temperature sensation, you can have certain tools or gadgets with you. One end is usually cold. You can have an object with one cold end and one end which is of normal temperature, and patient can assess those two modalities comfortably. He or she can differentiate them comfortably. Again, the lateral column sensation will be checked the same way. Like if you have got test tubes, one is warm, having warm water, and say this is another test tube with cold water, you would just be placing them distally on the patient's feet, and you will keep on moving proximally. If patient can appreciate distally the sensation of cold as well as the sensation of hot, you are not supposed to move proximally. So these sensations are done checked in the same way. And finally, the last thing in sensation examination, the cortical sensations. Cortical sensations can only be checked. Remember, if in exam, examiner gives you command to check the cortical sensation, they can only be checked if patient is having normal sensation of touch. If patient is having no sensation of touch, this cannot be checked. So whenever examiner gives you command to check the cortical sensation, you can ask the examiner, sir, to check the cortical sensation, I need to know whether patient is having normal sensation of touch or not. So can I first check the sensation of touch? Most of the time examiner tells you that his sensation of touch is fine. Just go ahead with the cortical sensation and then you can examine those sensations. Because if somebody is not having sensation of touch, how he would be able to appreciate the texture of a certain thing, or if you would be writing down certain thing, he won't be able to appreciate. So these three sensations are, one is astereognosis, one is graphesthesia, and the third one is 2-point discrimination. How to check for astereognosis? You will be placing a certain thing in the hand of a patient, and you would be asking the patient that in your opinion what it is. You would ask him to close his eyes, that you placing certain thing in his hand, and you would ask this question from the patient. आंखें बंद कर लें अपनी. ये मैं आपके हाथ में एक चीज़ पकड़ा रहा हूँ, इसको ऐसे रख लें. ये क्या चीज़ है आपकी नज़र में? चाबी है. So this is how you will be checking. So I ask the patient that I am going to place something in your hand. Please close your eyes and tell me what you can appreciate. So this is the astereognosis. Then graphesthesia. In graphesthesia, what you will be doing? I will be in need of ballpoint. Thank you. So what I'll be doing, I'll be telling to the patient that I'm going to write down something on your hand. Please tell me what I have written. ऐसे कीजिएगा, मैं इस हाथ पे कुछ लिखूंगा तो आपने मुझे बताना है कि मैंने क्या लिखा है, या कोई शक्ल बनाऊंगा. I would be telling to the patient that I would be making a certain shape. So please tell me what kind of a thing it is. आंखें बंद कर लें अब अपनी. क्या बनाया जी मैंने? So गोलदारा बनाया. So it's very simple. मैंने just एक सर्कल बनाया, गोलदारा बनाया, तो patient has appreciated that this is the circle. And the last thing is 2-point discrimination. For 2-point discrimination, say I am having two toothpicks. I will be placing these two toothpicks at a certain distance on the hands of the patient. And what to do here? I would be placing these two toothpicks, say, on the hand of the patient at a certain distance. If they are at a certain distance, patient would be able to appreciate them individually. Like he would be telling me that you have touched two things at the same time. But if they are beyond a certain distance, patient will not be able to, if they are like very close, patient will not be able to tell me, but if they are at a certain distance, patient can comfortably tell me. The sensation in the palm, it is very sensitive because there are a lot of nerves and these nerve endings are in close proximity. So one can appreciate that sensation in a much better way on palm in comparison with sole or in comparison with the back. So I am I am touching his palm with two toothpicks, say, and I would be first telling to the patient, you need to tell me whether I have touched your arm with one thing or two things. He can comfortably tell me. मैंने आपके हाथ को ना ये दो चीज़ें लगानी है या कोई एक लगानी है, आपने मुझे बताना है कि आपके हाथ को कोई एक चीज़ लगी है एक वक्त में या दो लगी है, ठीक है? सो आंखें बंद कर लीजिए जी, बताइए जी, ठीक हो गया. अब दो लगी हैं. अब दिस इज वेरी क्लोज. अब ठीक हो गया, और अब ठीक हो गया, और अब एक लगी. ठीक. So that's the differentiating feature, that in palm, if a thing is in very close proximity, say, patient won't be able to appreciate it as two sensations and two things separately. And if I'll be placing the same thing on sole of foot, if it will be even at a certain distance, these distances are different for palm, for feet and for back. The patient won't be able to appreciate that much in sole of the foot because nerve endings are a bit distant, and the same way at back they are very distant. So you need to place those things almost 4 to 5 centimeters away, and patient can appreciate that there are two things touching on the back of the patient. Thank you very much. तो आपका